Hello, welcome back to Caring Nurses 101. My name is Christine. I'm an RN, I'm a coach, a mentor, and educator. And today we're going to be talking about the three characteristics of a healthy nurse. Number one is compassion and sensitivity. And compassion and sensitivity, when you think about those two, they are very similar in meaning. But there's one distinction between the two. We're going to talk about compassion is a feeling that arises when one is confronted with another's suffering and feel motivated to relieve that suffering. And sensitivity is ability to recognize and understand the emotional aspects of the suffering of others. So the distinction between the two is that sensitivity, you understand the suffering of others. And in compassion, you feel motivated to do something about the suffering. So that's the first characteristic of a healthy nurse. A healthy nurse exemplifies compassion and sensitivity towards all patients, not only the ones that are respectful, cooperative, and proactive, but we also have to learn the skill of how to show compassion and sensitivity towards the non-compliant patients, the demanding patients, the confrontational patients, and the argumentative patients, because you will experience all kinds of patients when you're in the hospital. Some can get to be very hostile and some are very mean, but you have to show compassion and sensitivity at all times. This is crucial as nurses are the cornerstone of the healthcare system and have regular contact with patients. You are the cornerstone of the healthcare system. And everywhere in the hospital are patients. When you go in every department, most patients are there. Some are in the X-ray department, some are in surgery, on the units, and in the lab. So you have to exemplify this at all times. Compassion plays a significant role in nursing practice and is highlighted in the value statement. The value statement is the mission statement. A mission statement is what a industry or corporation stand on. And every institution, every industry has a mission statement. And compassion and sensitivity are in that mission statement with any hospital that you go to. The lack of compassion can have a negative impact on patients, particularly the elderly and those suffering from terminal illnesses. So if you feel that you lack this essential characteristic, this may be the wrong field to work in. And an example of compassion and sensitivity, I have been a nurse over 30 years, and I had to exemplify compassion and sensitivity as I reflect back every day, sometimes 4, 5, 6 times a day. So it's something that you have to have a inner to be something that's already there with inside of you. I don't know if you could develop compassion, and you can learn how to be compassionate. I mean, learning and going through nursing school, they will teach you the characteristics and how important to interact with your patients. But that's something I think that you have to be at an innate characteristic or virtue within inside of you. I had, for example, you have patients. I had this elderly lady. She was diagnosed with pneumonia. She was close to 90. She was very, very tearful, upset. She was lonely. She didn't have any family members. And, I just automatically was drawn to sit down beside her, take her by her hand, and just listen to her concerns and her fears. And just being a companion, that's another characteristic of being a nurse. You have to show companionship. And I took her by the hand and I just listened to her while she addressed her shared her concerns and fears. And when a patient is in this state of mind, we usually contact the chaplain to come pay a visit to the patient, and also we call social worker and ask them to visit the patient while they're in the hospital. Your compassionate and sensitive approach helps the patient feel valued and supported during a difficult time. And so this is very important. Not only the elderly, but every patient that comes in the hospital, they're away from home, they are in an unfamiliar environment, they don't know what to expect, and they're worried and they're anxious about what the doctor's diagnosis may be. So having these characteristics is very important when it comes to being a healthy nurse. So that's number one. So we're going to get into number two next week. And thank y'all for coming to Caring Nurses 101. Check me out on Amazon.com. I write books to inspire, motivate, and encourage women, nurses. And also I write educational resources on there for my aspiring nurses and my nursing students. And this is a very popular one that I suggest to all nursing students or aspiring nurses, the 10 principles to become a successful nurse. So check it out on Amazon. You can also find it on my website, www.caringnurses101.com. Thank you. Have a blessed day and have a safe week, Memorial Day weekend. Bye.